Hi, my name is Wadina Hani. I and our team from class BA2434B will present an article review on the topic of attitude. Let's begin with the abstract review. The review looks into the detailed connection between job performance and nurse personalities, attitudes in an effort to identify problems, obstacles, and also cross-cultural dynamics in the healthcare environment. A comprehensive global perspective on healthcare challenge is provided by the exploration, which covers a various international research and also address a specific concern like a public attitudes towards hospital visit in India during the pandemic, mental health stigma among the healthcare professionals in Qatar, and also attitude of US hospitality managers towards employees with depressions. The article review explores important aspects of healthcare such as hand cleanliness in different healthcare settings, the use of telemedicine during COVID-19, and also patient safety ideas. The result highlight how important it is to implement focused interventions to improve these procedures and also patient outcomes in the healthcare industry. The article aims to bring into barriers between cultures, provide information on important concerns regarding nurse attitudes, and also investigate ways to resolve tension that have been brought up in earlier publications. Understanding the complicated relationship between personality traits and also job performance in the healthcare industry is a given particular emphasis. Based on research conducted by specialists such as Manaswi Shamsudar and also Suhaila Goyal, the paper offers an international outlook on healthcare issues. The topics cover a wide range of healthcare-related issues, from managers' attitudes towards employees who suffer from depression in the USA to hand cleanliness procedure in India during the pandemic, and also the method outcomes and important discoveries of each study are truly examined in the section that follow. Topics covered include attitudes towards hospital stays during the pandemic.
Okay, first objective is to review the relationship between personality attitudes of nurse and job performance. Next is to analyze the issues and understandings based on findings in journal. And then to observe more about the barrier and the cross-cultural that happens between nurse attitude, patient and workplace. And then to investigate the solution to the conflict that comes out from each previous article. And last but not least is to identify the role of employee development in moderating the relationship between personality traits and job performance. Identification of issue. Firstly, Masnawi Shamsuddar 2021 mainly predicted that in India, attitude and behavior of people towards visiting the hospital during the pandemic. The issue identified in this report is both nurses and doctors had moderate knowledge of hand hygiene. There was a significant difference in self-reported practices, with doctors having better practices compared to nurses. Second, Suhaila Gulom 2022 predicted that in Qatar, healthcare professionals' attitude towards patients with mental illness. The issue discussed in this article is the attitudes of healthcare professionals towards patients with mental illness. The study aims to assess the attitudes of healthcare professionals in Qatar and identify any potential barriers to providing quality care for individuals with mental illness. Thirdly, based according to Valentini Calagrau, 2022 state that in USA, managers' attitudes towards employees with depression and organization citizenship behavior in the hospitality industry, assessing the mediating role of personality. The article discusses the attitudes of managers in the hospitality and tourism industry towards employees with chronic depression. The study also highlights the role of personality in mediating the effect of managers' attitudes on organizational citizenship behavior. Next, Article 4, based on studies from Bettina Boucher, 2019, attitudes of doctors and nurses to patient safety and errors in medical practices in the Gaza Strip, a cross-sectional study. The study determined areas that need improvement and future training by evaluating nurses and doctors' attitudes towards patient safety concept. Consider it might affect their behaviors and practices in providing safe and effective care. Since patients' safety directly affects patient outcomes and well-being. Besides, in Article 5, based on research by Nitesh 9 2021, attitudes and perception of outpatient towards adoption of telemedicine in healthcare during COVID-19 pandemic. To make telemedicine services more practical and widely used, it is important to understand the behavioral attitudes and perspective of everyone. This can establish telemedicine enable healthcare patient choices and develop trust in these services while offering easily accessible, reasonably priced, secure and high quality care. According to research published by Pravina K 2017, hand hygiene, knowledge, attitudes and self-reported practices among medical and nursing staff of a tertiary care military hospital, a cross-sectional study mentioned the issue identified in the article is the behavioral attitude of employees in the public healthcare system in the state of Kerala, India. The study aims to measure the attitudes of doctors, nurses and staff in government hospitals towards patients and investigate whether patients are directed to private stores for services due to the lack of essential facilities in this hospital. Next, in Article 7, Iqrazia 2022 mentioned the issue found that while both nurses and doctors had moderate knowledge of hand hygiene, there was a significant difference in self-reported practices, with doctors having a better practices compared to nurses. Additionally, nurses had significantly better attitudes towards hand hygiene compared to doctors, but there was room for improvement in their attitudes and self-reported practices. According to Article 8, by Mingitsu and Hetty 2022, aim to explore the attitudes of nurses toward their professions and associated factors in selected public hospitals in Addis Ababa, Ethiopia in 2021. The study found that some nurses in Addis Ababa city public hospitals had a favorable attitude towards their professions. The factors that are associated with the overall nurses' attitude towards their professions, including experienced nurses, managerial support, ethical-related training, and belief in the community. In Article 9 by Azizi Aidemir 2023, he explores the critical issue of patient safety culture and the attitudes of nurses working in emergency units in hospital in the Samsun region of Turkey. A few issues were found in the article by emergency nurses, such as high patient loads, understaffing, and the reluctance to report medical errors. It also emphasized the impact of work-related factors, including job satisfaction and work-life quality, on nurses' attitudes towards patient safety. Moreover, according to Article 10 by Anglim 2019, individual differences are widely recognized as important predictors of workplace behaviors, attitudes, and outcomes. The issue states that there are three types of individual differences, namely personality traits, values, and cognitive ability, which have been recognized as relevant predictors of workplace behaviors and are routinely used in personnel selection processes.
Hi, my name is Adina and I'll represent about the issue discussion and analysis. The first one is Manashri Samsundar 2021. The study taking an online survey, it contained the demographic of the respondents such as age, sex, nationality and occupation. Second, Suhala Golem 2022. The research applied new statistic tests improvement to the current statistic and scripting process. A new production facility feature are all included in IBM SPSS statistic version 20C. Next is a descriptive cross-sectional study examining the frequency of a disease or condition in a given population at a certain point in time, without making any assumption or proposing explanation for the frequency. Valentini Callegrio 2022, Bettina Boche 2019, Mission Knight 2021, Pravina K 2017 have same analysis which is using Socio-Economic Pathway SSPS version 20C and 28. Next is Smart PLS3, a software with graphical user interface for various base structure equation modeling with using the partition least square path modeling method. Besides, structural equation modeling (SEM). SEM is a multivariate statistical analysis technique that is used to analyze structural relationships. This technique is the combination of factor analysis and multiple regression analysis, and it is used to analyze the structural relationship between measured variables and hidden ideas. The research also used questionnaire and online survey. ICRASIA 2022, utilizing a self-administered questionnaire. Then using both descriptive and inferential methods. Descriptive statistics summarize and describe data, while inferential statistics draw conclusions and make predictions about populations based on sample data. Following it also include multiple linear regression and chi-square analysis. Chi-square test is used to analyze nominal data, mostly in chi-square distribution. The distribution of data is positively skewed. Regression analysis is used to test the relationship between independent and dependent variables in a study. Mengistu and Hapti 2022. The research applied quantitative cross-sectional study and structured questionnaire. Apart from that, it's analyzed using statistical software including descriptive statistics, bivariate and multiple logistic regression analysis to identify the significant predictor of nurse attitude toward their profession. Aziz Adamer 2023 employ cross-sectional, descriptive and correlational methodology. Aside from that, patient safety attitude scale and the patient safety culture scale. In addition, they also make a random sampling. Aglin 2019. Last article is include Hazako Personality Inventory, Schwartz Portrait Values Questionnaire, Asser Measure of Numeric, Verbal and Abstract Reasoning Ability, the Attitude Toward Diversity Scale, and 4-Scale Measuring Prejudice towards female workers, ethnic workers, older workers, and workers with a disability. And the last part is recommendations. In light of foregoing conclusion, then a few recommendations can be made below. Firstly, Manaswi Samsundar 2021 mentioned that based on the findings of the study, it is recommended to develop strategies to address the concerns and fear of people getting hospital visit during the COVID-19 pandemics. This can include implementing strict infection control measures in hospitals to minimize the risk of transmissions, providing clear and accurate information to the public about the safety measures in place, and promoting telehealth service for non-emergency consultations. Next, Suhaila Gulwam 2022 stated that healthcare professionals should receive educations and training on mental illness to improve their knowledge and understanding. This can help to reduce stigma and negative attitudes toward patients with mental illness. Thirdly, Valentini Gajirao 2022 mentioned that companies should offer comprehensive training programs that can educate managers about mental health, including depression, its symptoms, and its impact on employees. The training should also focus on developing skills for effectively managing and supporting employees with depression, such as active listening, empathy, and providing appropriate accommodations. Based on Article 4, Bettina Bocher 2019 indicates to create customer training curricula that provide to the requirement and viewpoint of doctors and nurses regarding patient safety. Healthcare organizations can improve the culture of patient safety and healthcare employees' attitudes toward patient safety by putting this idea into practice. This will ultimately improve the quality of treatment that patients get. According to Article 5, NITES 9 2021, it is advised to increase telemedicine service usage and promotions. Additionally, efforts should be made to raise the standard of telemedicine services to guarantee that patients receive the same quality of care as they would in a usual medical facility. To boost patients' trust in adopting telemedicine, education and awareness initiatives can also be carried out. Furthermore, based on Pravina K 2017 mentions to elevate the standard of healthcare services, it is imperative for government hospitals to prioritize the improvement of essential facilities. This involves ensuring an adequate presence of skilled staff, maintaining well-equipped laboratories, updating and modernizing medical equipment, and increasing the number of available beds. In addition, the key recommendation for improving healthcare practices revolve around addressing healthcare workers' attitudes towards hand hygiene. Healthcare professionals can be motivated to adopt and maintain proper hand hygiene practice. These recommendations aims to create a culture of responsibilities and continuous improvement in hand hygiene, ultimately contributing to a safer and more hygiene healthcare setting, as mentioned by ICRA Zia 2022. Article 8, Magnus 2 and Hafti 2022 recommends that by increasing nurses' salaries to enhance their job satisfaction, providing ongoing ethical and professional development training, and promoting a more positive image of the nursing professions in the community to foster a more favorable attitude among nursing staff. Regarding Article 9, Azizi Aydemir 2023 recommends a need for healthcare institutions to prioritize the development of patient safety culture and encourage the reporting of medical errors. The study emphasized the importance of creating a non-punitive environment for error reporting and suggests that training for nurses in high-risk services can improve patient safety culture. To sum all up, a variety of factors such as individual belief, organizational culture, and duties at work might have an impact on the attitudes of doctors and nurses in healthcare environments. Despite the fact that patient care and safety are prioritized for both professional associations, for example, how doctors and nurses' attitude in a hospital has a significant impact on how the healthcare system functions as a whole, how patients get alone, and how well the care is delivered. It is clear that attitudes have a big influence on how doctors and nurses interact. Doctors might consider themselves as having a leadership positions, but nurses place more emphasis on respect and working together to make decisions. These differences in viewpoint have potential to support undetermined interprofessional cooperations and teamwork, which ultimately impacts the standard of patient care.